in honor and memory
of our mothers, our sisters, our daughters, and our girlfriends
who have shown unbelievable strength and resilience
through their survivorship journey.
We thank you for inspiring us
and reminding us of the beauty of today.
Welcome to the Lean Study, which stands for Lifestyle, Exercise, and Nutrition. I'm Maura Harrigan, and I'm the registered dietitian on the Lean Study. I'm also a board-certified specialist in oncology nutrition.
Hi, my name is Sanft. I'm a breast medical oncologist and also the director of the survivorship program at Yale and Smilo Cancer Hospital.
Hi, I'm Melinda Irwin. I'm a professor of epidemiology at the Yale School of Public Health and co-principal investigator of the Lean Study.
Do you realize that a course of chemotherapy can make you lose 10% of your muscle mass? That's the same amount of muscle you lose in a decade of aging. In addition to the impact on muscle, the treatments can affect the density of your bones. So the exercises that we have you do in the Lean Study are to offset that.
In my experience, women who eat healthfully and exercise during chemotherapy feel better. And when they come in for their visits, they're surprised at how good they actually feel and how much control they have over their life during this very difficult time.
So we have designed this study to make it hopefully as easy as possible for you to participate in it over the next year. So some of the visits will occur during your chemotherapy when you come to Yale for those sessions, and some might be over the telephone.
So now that you've been randomized to the intervention group, we've got a lot of work to do together. You may find especially when you're newly diagnosed, that lots of people are offering you nutrition information. And not all of it's good. And sometimes it's confusing, and sometimes just downright overwhelming. And what being in the Lean Study will help you is to cut through that noise and learn what it means to truly eat well.
I really think the most important thing to me is taking care of the whole person, not just the disease. Every part of you is important, from what you put into your mouth to what you do all day and how we treat you.
We understand that many of you may not have been very active prior to your diagnosis. And now we're talking about doing exercise during treatment. But I don't want you to worry about that. In fact, the first step you take in the exercise component is just to stand up more. Reduce your time spent sitting. We call that standing up to cancer.
We've made a series of videos that takes you through the strength training exercises and shows you how to do them in a safe and effective way.
So we've developed the Lean book to go along with this study. It's an evidence-based book with 16 chapters that will guide the 16 sessions throughout the year.
The book is designed to give you a skill set about how to eat well and also how to exercise. And this skill set you can then carry with you well after treatment.
We cover important topics, including how to read food labels, why it's important to walk 10,000 steps per day, and we answer many common questions that breast cancer survivors have.
So while we're busy reading our book and going through our sessions together, there's some homework you have to do, and it's called logging.
During the study, we're going to ask you to write down a lot of things. This is called logging, and it's a very important part of the intervention. Examples of the things that we will ask you to log include what you eat, the number of steps you walk per day, how often you exercise, your strength training sessions, and also any symptoms you might be experiencing.
I know that sounds like a lot of logging, and it is, but it's such valuable information that you and I will use together to help establish your healthy eating and exercise routines.
Prior research has really shown the benefit of actually recording what you eat and the exercise you do and helping to change those behaviors. So you'll be working with a registered dietitian who you're going to meet with 16 times over the year, and she's going to counsel you on how to change these behaviors. And sometimes it involves looking at your daily schedule and how to fit exercise in and how it works with your routine and how to make simple changes in your eating habits that'll help to make these lasting changes.
So remember, we're a team. We're doing this together.
We commit to you to bring our best selves to every session, to answer your questions, always be honest, to support you during difficult weeks, and celebrate the triumphs.
So your responsibilities are to do your best and to stay open and stay willing and to hang in there.
So let's get started. Open up your lean book, read the introduction, fire up your Fitbit, and get ready to work as a team.
Let's get out those dumbbells. Let's look through some good lean recipes and get to work.
We're so thankful that you're participating in this study that's hopefully going to really change the standard of care of the way women are treated with breast cancer. Without you, we wouldn't be able to move this field forward. So thank you.
We're very excited to start this next part with you.